Hello, this is Dr. Jeremy Orr, and I'm recording a demonstration of Practice Partner using the Neurology demo script. This Camtasia video accompanies the Neurology demo script template and associated quick text. All of that template and quick text should be installed on demo version 9.4 and higher, and you can refer to the demo script for some more detail on how to prepare for this demo. For the rest of this demo, I will speak as if I'm discussing this with neurologists. So when creating a note in Practice Partner, it's as simple as clicking on the note icon up here in the clearly labeled buttons. And this will open up our Bright Note screen, which allows you to input data any number of different ways by dictating or by using a template. In this particular case, I've created a template that allows us to do a number of different neurological problems, and I call this one Neuro Consult. So I just look it up by neuro and insert that Neuro Consult template right into my note. Now once I'm in the template, I can click on choices. I can type text right in, or I can dictate text right in. You'll see me do a little bit of both here, and then at the end I'll deconstruct the note for you and show you where the other information goes in the chart. So we'll select from a list of chief complaints for neurology. And we'll also select from a list of referring physicians and primary care physicians. This can also be populated in a field called referring by your front desk staff if you so preferred. And now I will start entering some information by dictation. Consultation on headaches and confusion. Period. Mrs. Smith is a 66-year-old woman with a history of headaches over the past 2 months. Period. She states she did not have a history of significant headaches, but since last April has gotten multiple headaches that are associated with nausea, visual changes, photophobia, and phonophobia, period. Medicines like Percocet, Vicodin, and Imitrex have helped, but she continues to get headaches, period. It is of note that during one of her headaches, she reported to the emergency room because she became slightly confused, period. The confusion quickly resolved, period. She does not remember much about that morning and states that at that time she did not know how she got to work that morning, period. She wishes to get off Percocet because it makes her sleepy, period. She denies any weakness, numbness, or other focal symptoms, period. Her headaches have not been progressive in nature, period. She denies any history of head injury, period. She denies any family history of aneurysms, period. She does note that in the past, Imitrex has helped to abort these headaches, period. She gets approximately 4 headaches a month, period. She denies any particular precipitating factors, period. They usually resolve within 72 hours, period. New paragraph. Here's an option to enter another complaint if we were so inclined. We just click on the symptoms or start dictating. For my review of systems, I've chosen to use a default all negative review of systems, and then from that I'll modify and I'll add, for example, for the neurologic complaints, the issues that she's dealing with today. Except headache and confusion. Now this template automatically pulls in her major problem list, past medical history, family history, etc. I might add a little bit of relevant family history here today. She denies any family history of aneurysms, period. Her social history is imported, med list, allergies. Now you see her vitals are there. Now I know she's not here for this. This is primarily her primary care doctor's problem, but her blood pressure is elevated today and an alert comes up. We have the option of following up on that later. It's nice to build alerts into the system. Now for my neurologic problem template, I've inserted a neuro exam that can be easily edited, just like any text document. You can just drop in and edit it. I'm also going to drop in a normal exam. You could also make a neurologic exam like this that goes off of a pick list. If you prefer to do it that way. For my regular exam, I just click on this one if I want normal. I can also document by exception, normal except for, or to get a list of abnormals if I wanted to. We'll just keep it simple this time. Do a heart and lung exam, and when we get to the section on neurologic exam, you'll see that I have the option here to drop some text in. In this case, I'll just say something. Please see below. So now I get to my assessment. I can make the diagnosis of some common neurological problems based on this drop-down menu, and I will do that. I can also dictate a diagnosis, and notice that it pulls in my ICD-9 code, and that goes over to my electronic encounter form for billing. Mrs. Smith is likely suffering from complex migraines, period. Now I can also dictate a little bit more about my plan. Mrs. Smith would benefit from some further evaluation at this point, period. With this new presentation of headache in a 66-year-old woman, I typically will get an MRI, period. If she reported a history of headaches over her lifetime, I probably would not order imaging, but given that this is a new onset of headache that has been associated with confusion, I think it is reasonable to get a brain MRI, period. Also, she has some risk factors for TIA, period. We can also continue to try a different medicine, period. I think I would like to try Trexamet, as she has had some success with sumatriptan in the past, period. We will also order some further workup as below, period. She has been instructed to follow up with me in 1 month, sooner if her symptoms worsen, period. Also, a handout on vitamin supplements and migraines was given to the patient today, as well as a migraine diary, period. So now I can order some workup if I like. We did talk about ordering a MRI of the brain, so we'll go ahead and put that in there. And you see that here there's a number of options. We can do EMGs, other imaging studies, laboratory tests. All of those are options, and they will drop into your note. Let's write our prescription now. Now, this is our prescription module, and prescriptions can be organized by problem or by name. I have created a template here for migraine medicines, and in particular for Trexamet. So I'll just drop that into my prescription form. You see it populates everything nicely for me. I've in advance written an extended SIG because Trexamet's prescribed a little bit unusually, so I preferred to write it out in text rather than populate it with frequency and duration, etc. Now, as soon as my prescription is done, I have the option of sending it electronically here, faxing it, printing it. We won't print this one, but it's just a simple pull-down menu to determine where you want that prescription to go. And that will go into my notes. Below this, below my order section, and after my prescription is complete, I have a nice section here where I can document some different documentation that I looked at. And today I will, and I get points for this in coding as well, say that I reviewed an outside medical record, and also I'm going to send a copy of the note to the referring provider. Scrolling down a little bit here, we have the option of giving the patient some patient handout, educational material. In this particular case, I did want to give her a handout on migraine, and you can link this to whatever types of handouts you like. There are some built-in ones with Practice Partner, but you can also link it to ones that are specific for neurology if you preferred. We did talk about having follow-up in 1 month. Now this will send a message to my front desk, and at checkout we'll make sure that she has a follow-up appointment. This is just a little note sent back to the referring provider. 303-555-1212. And that's the fax number. I'm also going to write a little note on here. Please also note that Mrs. Smith's Blood pressure was elevated today, and I have asked her to follow up with you on this issue, period. Okay, now, this is a nice little feature, a reminder. The system is recognizing that we wrote a prescription today in a Medicare age patient. Do we want to get our e-prescribing bonus? We do. And that will finish up our note. So we'll press OK. Permanently done with note, yes. Now the nice part here is behind the scenes we were getting points for our subjective history, our exam, review of other items, as well as ordering of tests. And so it proposes a code based on the maximum possible documentation. We can also change that to a consultation type of visit if we were inclined to do that, and that would be appropriate for a neurologist to do. It is a legal document, so we do have to sign every note. And let's take a look at what that completed note looks like here. We go into the progress note. All of the extraneous information from the template will disappear, and what you're left with is a nicely formatted note that's suitable for sending to your referring physician. And there you see your exam, your diagnoses pulled in, your discussion, orders, and follow-up items, and your prescription is there as well. When we go to the rest of the chart, we can see now that the Trexamet prescription is there. We can also see that the order for our MRI is there and now pending, ready for someone in our office to pick that up and either refer out or send an order sheet, whatever your workflow is. And then finally, if we look at her problem list, now under diagnoses, confusional state, migraine are both on there. That's the end of this presentation. Thanks for your time. Refer to the script for more information. Thank you.